Living longer, living healthier, living better than ever before. Welcome to Mountain Pacific's Healthy Living for Life, a weekly series that gives you the information, education, and expert insight you need to become an active participant in today's ever-changing healthcare climate. Here now is today's program host.
Every 11 seconds, an older adult is rushed to the emergency room because of a fall. Falls are the leading cause of fatal and non-fatal injuries for older Americans. Not only are falls dangerous, they're scary, leading to a fear of falling that causes seniors to become less active and withdrawn. But there's good news. Most falls can be prevented, and that's what we're going to talk about today. I'm your host, Beth Brown. Welcome to Healthy Living for Life, a show dedicated to helping you do just that. Welcome back. Even though 1 in every 3 Americans over the age of 65 falls each year, most people do not tell their doctors they fell. But did you know your doctor can actually help keep you from falling while also helping you stay healthy, active, and independent? Dr. Roman Hendrickson joins us this morning to talk about how your doctor could be a great resource for your personal fall prevention. Thanks for being with us this morning.
Thank you.
So this probably seems like an obvious question, but can you start out by talking about what a fall really is so that people know when they should tell their doctor when they fall?
Well, really, it's any unplanned contact with a surface that's not the result of a push or a pull, not the result of passing out or something of that nature. So you don't have to actually crash on the floor, but if you just kind of lose your balance and fall to one side, that would count as a fall.
Like to a chair or something too, not just...
Correct.
Okay, great. And there are physical reasons why people might be more at risk of falling. Can you talk about some of those conditions or ailments that people might have that could put them at risk?
Right. The most common that we see is probably physical inactivity, because with the lack of physical activity, people's muscles become weaker, they're less responsive. You can, in association with that, develop less balance. These kind of things, if we can identify them, then we can send them to the physical therapist, and the physical therapist can work with them. In addition to that, things that people don't always think about are vision problems. People who have bifocals are much more likely to, at least when they initially get them, to misjudge surfaces and then fall. People with cataracts, decreased vision in general, decreased hearing. Hearing can be a problem as well because people are so distracted by trying to concentrate on what they're not hearing that they may fall. Joint problems. People have a joint that they can't trust and their posture changes. Neuropathies where their sensation is different. And nutrition. Nutrition's a big one that, if you don't drink enough fluids, you can get lightheaded, you can get weak. If your vitamins and minerals are off, your muscles don't work as well. And what people a lot of times forget is that as we age, all of us, our reaction time gets not as good.
Sure.
So if you lose your balance, you can't recover as quickly. And if your muscles don't cooperate, you're really in bigger trouble.
And so what can happen after somebody falls?
Well, you can obviously fall and fracture a bone. You can have a strain or a sprain. You could have an injury where you strike your head, have concussion or other brain injuries. You can have tremendous expenses, obviously, if you have an injury. You can have death. About 1 every 19 or 20 minutes in the United States, an older person falls and dies as the result of the falls. There's a significant number of serious injuries from what would seem to be insignificant falls.
Okay, and so when should someone talk to their doctor about either a fall they've had or fall prevention?
Well, I think that it's important to talk to the doctor if you think that your balance is starting to not be at the level that you're used to or you perceive that it's changed. If you're having trouble getting up out of the chair or you fall back into the chair, if you almost fall or if you do fall, all of those things can tip us off that there's things we need to evaluate.
And so what about fall prevention? Let's say, for example, someone is going to just their physical every year or something like that. How would they bring that up to their doctor if it's not why they went? I know sometimes people are a little bit uneasy to kind of just bring things up. Do you have any suggestions on how they can approach that subject?
I think people a lot of times will address it by saying my balance is off. I find that I'm not as steady as I used to. And then when you pursue that avenue of questioning, you'll find that they actually had falls. And that's why they perceive their balance is off. Or they can say, you know, I've had a couple of episodes in the middle of the night where I lost my footing. You know, they don't have to come out and say I fell, I did things that would make you think that I'm weak or frail. But I think just addressing the issue that, you know, they're unsure. And fear of falling can be just as crippling as falling. People who are afraid they're going to fall start to limit their activities. They don't go out of the house. They don't want to socialize as much. So bringing it up, discussing it, trying to get something addressed to that problem, that concern is important.
And so if they do bring it up with their doctor, what can a doctor do to help them with fall prevention or make sure that they're not fearful or they don't get hurt?
If we identify and think that there's a problem with their balance or their muscles and how they're responding to a situation, a lot of times we can refer them over to physical therapy for evaluation, exercises, various interventions. We can inquire as to what their diet is like, how much fluid is going in. There are certain medical conditions that may contribute to it, so we can potentially evaluate for those. Medications, of course, are a big issue. A lot of the things that we use for one problem can create another. And especially if you've added a new medicine, at the time you add a new medicine is the time when you're most likely to see changes. If people don't tell us these things, we may not be aware that those problems exist.
And if it is something with vision or hearing, should a person talk to their primary care physician about those kind of things, or should they wait and see a specialist, or what would you recommend there?
Well, if there's a concern about hearing or vision, I mean, we may be able to do a screen to see whether it's a valid concern. Sometimes people feel like they have a hearing problem. Wives a lot of times will question whether their husbands are deaf. Turns out they're usually not. Vision, we can screen for as well. And the ones that it's a valid concern, we can help make sure that the person gets to the right person to be evaluated.
Perfect. Thank you so much for all that information. Coming up next, can what's in your medicine cabinet put you at a risk for a fall? Some medications are also a big factor in causing falls, as Dr. Hendrickson said. Find out which ones right after this. Medications save lives and often play a vital role in managing people's health, especially as we age. But they can be a double-edged sword when their side effects can cause problems like a heightened fall risk. Joining us now is pharmacist Angie Woodmansey, who will talk with us about how to better understand medications and to help make sure they don't cause falls. It's great having you here today. Thanks for being here.
Thank you, Beth. I'm happy to be here.
Let's start talking about some of the medications that can cause falls. Are there different types that people should be aware of, especially older adults?
Definitely. There are certain categories of drugs that have a heightened fall risk. And what I always advise patients as a pharmacist is to always look at your prescription drug bottles. On them, you'll see these colorful stickers, and those are warning labels. If they see anything that says may cause drowsiness, may cause dizziness, may impair your ability to drive, those are big red flags that those medications could increase your risk for falling. And then if you don't mind, I thought I would just kind of go through different categories of medications to kind of give a little bit of tidbits about each of them. The first big category would be sedatives. These are sleep agents. They can be prescriptions such as Zolpidem or Ambien, or even over-the-counter products that contain diphenhydramine or Benadryl. These medications are designed to make you sleepy, which is great if you're using it for insomnia, but if you have to get up in the middle of the night to go to the bathroom, that can put you at a great risk for falling. And also, they're really designed for short-term use. So if you're finding that you're having to take a sedative every single night, it's really important to talk to your doctor about that, to maybe talk about non-medicine ways to help you fall asleep at night. And then the second category of drugs I'd like to talk about are anti-anxiety medications, particularly benzodiazepines. These are drugs such as diazepam or alprazolam, and these are also kind of designed for short-term use for really acute anxiety. and they can make you very drowsy to calm you. But if you're taking those every single day to manage your anxiety, those can also increase your risk for falling and for side effects. And so talk to your doctor, because there are other categories of anti-anxiety medications with a much lower fall risk.
Okay.
And then I'll talk about the next three categories. I want to kind of group them together, and those are antidepressants, antipsychotics, and anti-seizure medications. They all work on your brain, but unfortunately they can cause side effects of drowsiness, which can increase your fall risk. And so if you're on one of those medications and you feel a lot of drowsiness, talk to your doctor, because within each of those categories there's a spectrum of drugs. Some of them can cause more sedation and some of them can be more energizing. So talk to your doctor about finding the right one for you. And then the next category of drugs are the opioid pain medications. This is kind of a hot topic as they're very heavily prescribed. And these medications, of course, they contain hydrocodone or oxycodone or morphine, and all of them can increase your risk for drowsiness. And so you would want to use caution and be careful about chronic use of these medications as well. Talk to your doctor about maybe trying a non-opioid pain reliever if you can. And then muscle relaxants, such as cyclobenzaprine or Flexeril, are designed to relax your muscles, but because of that, that can increase your risk for being unsteady and for falling. So use caution with those. And also, surprisingly, overactive bladder medications have a side effect of drowsiness and dizziness, so something to be aware of. And even allergy medications, as we're approaching allergy season, that can also have an impact, because if you're taking an older antihistamine such as Benadryl or diphenhydramine, that can cause a lot of sedation. And so you would want to consider using one of the newer antihistamines if you could, such as Claritin or Allegra, as they're not as sedating. And then my next category are the blood pressure medications. These medications can greatly lower your blood pressure, which you want to happen. But if you're going from lying down to sitting to standing up very quickly, you can get a great drop in your blood pressure unexpectedly. And so I always advise patients on blood pressure pills to take their time getting out of bed and ease into that transition of standing up. And then our very last category are diabetes medications. These are designed to lower your blood sugar, but sometimes it can lower it too much and can cause symptoms of hypoglycemia, which can make you feel dizzy, drowsy, confused. So as a diabetic, you would want to be aware of those side effects and always have handy a source of sugar, such as juice or raisins or crackers. But that basically sums up the major categories of drugs to be aware of.
And there are several, and they are ones that help people manage their health on often a day-to-day basis, so they can't necessarily just stop taking these medications. So what should they do in that situation? Do they talk to their doctor or a pharmacist, both?
Oh, that's a great question. They definitely would want to talk to their doctor before stopping any medication. And that's really important, because sometimes you need to wean off of medications, and also sometimes they may just want to lower the dose of your current medication or switch you to an alternative medication. And really only a doctor can do that. But pharmacists are also a great resource. We're readily accessible. You can walk up to any pharmacy counter and talk to a pharmacist. And we are medication experts, so we are trained to help advise you about drug interactions or side effects. So really it's a partnership.
Great. And what about vitamins and supplements, Angie? Can those help prevent falls? Are they helpful to take?
Yes, there's been a lot of research about vitamin D, especially 800 to 1,000 international units a day, in helping seniors decrease the risk for falling. It can improve their bone, muscle, and nerve health, and so there's a lot of data on that. But do talk to a doctor before starting any supplement, just in case there's a reason you shouldn't be on it.
Okay, good. And what about then, we've talked on the show before about the importance of kind of sticking to one pharmacy or one pharmacist when you're filling your prescriptions. Is that important to do too when it comes to fall prevention?
Absolutely, because as a pharmacist, we can only see the medications that are being filled at that pharmacy that we work at. And so we don't know what you're filling across the street at another pharmacy. And so to really allow us to get a full drug interaction screen, we really need to know all the medications you're on. And so if you aren't filling, if you're doing some mail order, some at your local pharmacy, you want to let your pharmacist know what you're getting elsewhere.
Okay, perfect. Thanks so much, Angie. Great
you're
information.
Welcome. Great.
So we've talked about your body and your health. We've talked about your medications. Up next, what fall risks are in your home and around town? Stay with us. We'll talk more about fall prevention after these messages. Thanks for staying with us. Falls can happen anywhere, but more than half of the falls that occur every year happen in a person's home. So how can you avoid those day-to-day slips and trips? Joining me now is Steve Ryder with AARP to talk about fall-proofing your home and tips for fall prevention around town. Thanks for being here, Steve.
Well, thank you for inviting me, Beth. It's a pleasure to be here today.
Good. So let's start outside the home and talk first about if someone is out and about running errands, doing some shopping, what's some fall prevention tips they should keep in mind?
Well, sure. You know, most of the things I'm going to talk to you about this morning have to do with just common sense and just being aware of your surroundings. When you're out shopping at Walmart or wherever you happen to be at any kind of a store of any sort or restaurant, one of the things that you need to do is look down. Look at the things that can be tripping hazards to you. For example, if you're in a department store, one of the displays may have legs that stick out, and it's real easy to trip and slip and fall on items such as that. If you're going to a grocery store and you're buying your weekly groceries, sometimes spills happen. It could be liquid, it could be solid. Falling and slipping on rice, as an example, is a real common occurrence. But any kind of a liquid that happens to be in a storefront, and also when you're going into the entrance of any building, look for, if it's rainy season, look for water. If it's during the fall, look for leaves. Those things can get really slimy in the rain in the fall. And if it's in winter, look for any kind of ice accumulations that could cause you to trip. So again, it's just being aware of your surroundings and making sure that you know that there's a hazard there and avoiding it.
And you mentioned the winter, and so we know snow and ice can be tricky. Are there specific fall prevention tips for the colder months?
Yeah, there's some, again, it's about observance. One of the most common slip and trip hazards that happen to folks is from their cars. In fact, this happened to me two winters ago, is when you step out of your car, it's really common to actually slip underneath as you're stepping out, to slip underneath your car, and a lot of people will break their legs by doing so. What happens is that as you're driving in your auto, your feet are warm. So the soles of your shoes will become warm, and then if you stand on that ice or that snow, it just creates a non-friction zone that is really hazardous. So my advice to people is to either wear the slip-on chains that are available at almost any store during winter months when it's really icy in particular, or carry some cat litter. Some people like to use sand, but I prefer to use cat litter. Use the biodegradable stuff, of course, and keep it, alongside of you someplace in your car where it's easy to reach. And just grab a handful of it, spread it along the ground when you're ready to step out of your car, and that will give you a good, solid base for stepping out of your vehicle. That's
a great tip and one that I had not heard before. So, cat litter, it's good for more than one thing.
Just don't use the used stuff.
Okay, yeah.
Could get ugly.
Good tip there too. So I mentioned earlier that falls are most common in your home. Can we talk about some tips for fall proofing a person's house?
Sure. In the home, the thing is that we're all comfortable in our home, so we tend to just skate around and just go about our daily lives without even really paying attention. But things can happen in the home just as they can any place else. I don't know about you, but there have been a lot of times where I've just basically slipped on or tripped on nothing. Where I've been walking around and all of a sudden I'm just kind of head over heels, and what happened? And there was really nothing there, but there usually is something that caused that. And in my particular case, it's wearing sandals. So if I have nothing covering my toe, it's really easy for me to trip on something. So when you walk around the home, what I would advise if you ever have any kind of issues with slipping and tripping is never wear sandals, never wear thongs, because I know probably each one of your viewers has a story about where they've wore those and they've slipped and tripped on basically nothing. But there are other issues in your home. Keep it well lit. Make sure that you're aware of your surroundings, especially at night. A person, as they age in particular, can become very disoriented. In fact, it happened to my mother. About 5 years ago, my mother became disoriented at home, and she actually fell down about 15 stairs into our basement, which is concrete. She fractured her hip. Luckily, she had a life alert or some kind of a mechanism on that alerted the fire department, and they were able to come over and break down her door and bring her to the hospital for treatment, but it could have been tragic. My sister visited every day, but it would have been probably 10 hours before anybody found her.
Oh, gosh.
So the lesson there is, if she would have had some kind of a barrier on that door leading down to the stairs, probably wouldn't have happened. But some other common trips and slips in the home include the bathroom, which is probably the #1 area that people slip and trip. So in your bathroom, make sure that you have something to absorb any of the water that comes from your shower or your tub. Make sure that you have handholds, especially getting into a tub shower combination, because that can, when you're on one foot, that can be disastrous. So make sure you have something to brace yourself with. And also in the tub itself, if you get any kind of oil or anything in a bathtub, it becomes an ice rink. So make sure that you have some kind of an adhesive attachment in the tub that will help from slipping as you're taking your shower or your bath.
Okay, great. Great tips, Steve. Thanks so much for being here.
Oh, you're
Appreciate
welcome.
your time.
It's my pleasure.
That concludes our show this week. Thanks so much for joining us. We hope you are able to take the information you've learned today and talk with your doctor, your pharmacist, or make some changes around your home so you don't fall and get hurt. Until next week, stay fit, stay well, and stay healthy for life with Healthy Living for Life. Thanks for being here. We'll see you next week.
Healthy Living for Life is brought to you by Mountain Pacific Quality Health. We'd love to hear from you. If you have suggestions for future programs, visit our website at mpqhf.org or call us at 406-443-4020. You can also catch us on YouTube by visiting our website and clicking on the YouTube icon. Special thanks to Fire Tower Coffee House and Roasters. Production facilities provided by Video Express Productions.